Hello, guys. Today we are starting inflammation. Guys, before starting inflammation, do you know even a small mosquito bite can cause inflammation? It's fascinating, right? Let's see how it's the mechanism. Infla- inflammation. First, we'll write definition, guys. It's a reaction of a tissue, and its microcirculation, and its microcirculation due to pathogenic insult. Okay, let's try to understand this, guys. uh, Inflammation is nothing but it's a reaction of tissue. It is occurring in a tissue, right? It's a reaction of tissue, and it's microcirculation. Why it is called microcirculation? Because many cells are involved. Even a pathogen, which is a microorganism, is involved. Microcirculation due to pathogenic insult, due to pathogenic exposure. Okay. Next, before going to types of inflammation, let's see cardinal signs of inflammation. Why is this important? First, uh, guys, our main goal is to diagnose the disease, right? To diagnose, we have to elicit some signs, right, in a patient. To diagnose it is a inflammation, we have to look for these five signs. Hence, we call it as cardinal signs. Cardinal signs of inflammation. Cardinal signs of inflammation. We have five cardinal signs, guys. We have five cardinal signs. One is dollar, calar, rubor, tumor, functionlessa. Functionlessa. What is this? See, dollar is nothing but pain. Dollar is pain. Okay, dollar is pain. Calar means heat. We have studied now, guys. SI unit of energy or heat is joules, calories. Yes. Calorie, heat. Okay. Rubor means redness. Rubor. From R we can remember R. Rubor, redness. Tumor. Of course we know tumor. Wherever tumor is present, there will be a swelling, right? Tumor means swelling. Functional aside, it's a loss of function. It's a loss of function. To diagnose if there is any inflammation in a patient, we have to look for these five signs. Ah, I said, guys, even a small mosquito bite can cause inflammation, right? See, if there is any mosquito bite, if there is any mosquito bite in my hand, I can see pain, I can feel pain, right? I can feel pain, and there will be a heat, localized heat, and there will be redness in the site of mosquito bite, and there will be a swelling also. Yes, and there will be loss of function. Loss of function means main function of the skin is sensation, right? When there is mosquito bite, we cannot sense there. Means if you yes, no, if you just want to try, if some tiny hairs, or you can prick a hair and just You roll on the mosquito bited site. You cannot sense. It's a inflammation. Interesting, right? Okay. Now we'll go for types of inflammation. Types of inflammation. We have two types. One is acute inflammation. One is chronic inflammation. Acute inflammation and chronic inflammation. Guys, to rule out if there is any acute inflammation, we have to look for cells. Just remember for your lifetime, guys, neutrophil is a cell of acute inflammation, and macrophage is the cell of chronic inflammation. Cell involved. In acute inflammation, neutrophil. In chronic inflammation, macrophage. Macrophage. And we'll see mechanism. Mechanism. Guys, in acute inflammation, there is increased vascular permeability. Increased vascular permeability. Increased vascular permeability. But in chronic inflammation, there will be tissue destruction and wound healing. Tissue destruction and healing. Healing by fibrosis. Healing by fibrosis. Now duration. Acute inflammation, we know, right? Acute inflammation, any acute comes means it's a short period. It can last for hours to days. Time period is hours to days. In chronic inflammation, it is from months to years. Months to years. Okay. First, we'll see acute inflammation. Acute inflammation. Acute inflammation. Guys, in acute inflammation, there will be two types of changes. One will be cellular changes, and another is vascular changes. Vascular changes, cellular changes. Changes and cellular changes. First, we'll see vascular changes. Guys, what happens in vascular changes? Uh, see, there is a bacteria. There is a bacteria. Name it as Streptococcus or any other bacteria. Okay. When there is a bacteria, when body exposed to bacteria, immediately there will be a vasoconstriction. Immediately there will be a vasoconstriction. In turn, there will be a reflex vasodilation. Reflex reflex vasodilation. Okay, there will be a reflex vasodilation. It can vasodilation. It occurs in both arterioles or venules. Arterioles or venules. Guys, see. Previously there was a vasoconstriction, right? And immediately reflex vasodilation. We studied in physiology, right, guys? There will be a laminar flow, streamlined flow, right? Usually there will be a laminar flow. What is this laminar flow? Laminar flow is nothing but cells will be centered. Cells will be centered. Cells will be at center, and plasma will flow in periphery. This is plasma. These are cells. These are cells, and these are plasma. Okay. In laminar flow, cells will be center. Cells will be at center. When there is vasodilation, when there is vasodilation, these cells, these cells will come to periphery, come near endothelium. Why it occurs, guys? You can just relate it to the water running tap. What means, when you are washing bike or something, you can means you can correlate it with that. When you close and just suddenly open the tap, the water will go far distance and it will fall no to the ground. The same way it will happen when there is vasodilation, means when there is reflex vasodilation, these cells will come to periphery. Okay, these cells will come to periphery. This process we call, what is this, guys? This is margin, right? This is margin. We'll call this process as margination. Margination. Remember this, guys. I mean, we'll study this again in cellular changes also. See, in cellular changes, but remember this, uh, margination is a vascular process. It's not a cellular process. Vascular process. It's a vascular process. It's a vascular process. Okay. See, next we'll see changes in endothelium. Changes in endothelium. What is endothelium? Yes, it's a inner layer of blood vessel. Changes in endothelium. Guys, previously, how was the endothelium? See, if it is a blood vessel, these are endothelium. These are endothelium. This is endothelium, and this is blood vessel. Previously, two endothelium are adhered, or two endothelium are tightly packed by tight junction. This is tight junction. Tight junction means it is not allowing to it is not allowing plasma to flow out. Plasma flow is restricted here. Okay, but what happens in endothelium? Endothelium will constrict. Imagine, guys, if this is one endothelium and this is another endothelium, and there is a tight junction in between. If one cell constricts, it left a gap, right? Yes. Now what happens? Okay, this is endothelium. It undergoes constriction. This constriction gives gap. Why is this important? See, there is exposure of body to bacteria, right? It should do some mechanism to eliminate this bacteria. To do this, something should come. Means we know WBCs, RBCs, platelets. These all cells are present in center. But to eliminate this bacteria, we should have WBCs outside the blood vessel, right? Because bacteria is outside the blood vessel. So from this gap, WBCs WBCs will flow flows outside the vessel. WBCs will flow outside the vessel. Then this WBCs can eliminate the bacteria. Okay. Now, guys, not only bacteria will cause inflammation. Even do you know burns? Any cooking burns, while you are cooking, something will fall on the skin. There will be a burn and there will be a swelling, right? Yes. In case of burns, what happens? We know if there is any inflammation, there will be vasodilation. There will be a vasodilation and endothelium constriction, and which causes gap. From this gap, plasma flows out. Plasma flows out along with WBCs. We know this, right? But most of the burnt cases, see, if there is any cylinder blast in a home, or if there is any issue related to burns happened in a home, and a patient came with severe burns, we can treat burns, but the problem is uh, within a week we may lose the patient may die. Why is this happening? See, guys, there is vasodilation, endothelium constriction, and plasma is flowing out. Okay, plasma is flowing out means, yes, it's a shock. It's a shock, right? When plasma is flowing outside the blood vessel, it is causing hypovolemia. Hypovolemic shock. Hypovolemic shock. Okay, remember this. In case of burn patient, we lose a patient because not because of pain or something else. It is due to hypovolemic shock. Hypovolemic shock. Hypovolemic shock. Vascular changes. Just will recap. Vascular changes, Streptococcus bacteria came, vasoconstriction occurred, immediate reflex vasodilation occurred, and due to this vasodilation, the cells in the periphery, cells in the center came to periphery. We'll call this margination and changes in endothelium. Previously, there was tight junctions due to constriction of endothelium. Uh, we got gap in the endothelium. Through this gap, WBCs will float and plasma will float, and bacteria can be eliminated. And in case of burns, vasodilation, endothelium constriction, plasma and WBCs will float. Due to the flow of plasma more, in case of burns, we'll get shock. Since there is a decrease in volume of blood, it is hypovolemic shock. Okay. Next, we'll see cellular changes. Cellular changes. Cellular changes. What happens? What happens in cells? First step in cellular changes is rolling. Rolling. See, guys, if this is a blood vessel, if this is a blood vessel, if this is a blood vessel, I said you right. Cells will be center. Cells will be at center. WBCs. What is the cell of acute inflammation, guys? Yes, I can hear you saying neutrophil. It's a neutrophil. 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 Neutrophil is at center. This is endothelium. This is endothelium. Neutrophil. Guys, if this is a neutrophil, if this is a neutrophil, it has a receptor called Cialin-Lewis receptor. What is this receptor? Yes. Cialin-Lewis receptor. And on endothelium, there will be a protein called selectin. So selectin protein and Cialin-Lewis receptor. What happens, guys? This Cialin-Lewis receptor and protein and endothelium will form bond when there is inflammation or when there is body exposed to any pathogen. See, there is a bacteria here. There is a bacteria here, and WBC should reach here, right? WBC should reach here, and it should engulf or eliminate this bacteria. To occur, uh, for this process to occur, the neutrophil should reach here. How will it reach? First, normally neutrophils and all WBCs will be flowing without any restriction. But when there is bacteria, it will means this selectin protein on the endothelium will expose. When this is exposed, uh, the bond is formed between neutrophil and endothelium. This bond is, remember this guys, this bond is weak bond, weak bond, and we know this, right? Blood is flowing, blood flow, blood is flowing. Since it is a weak bond, blood flow can push the neutrophil. Blood flow can push the neutrophil. What happens? It will reach here. Again here, one more selectin protein is there, and another bond will form. And again the blood pushes, and again it will roll. Again it will roll till where, till it reaches a gap. Right guys, we said now, we know this now. Endothelium will leave gap. Endothelium will leave gap. If the neutrophil finds a gap, then it will stop. So next it will, when there is a gap, it will get attached. We'll call this adhesion. Adhesion. Next process is adhesion. In adhesion, what happens? See, this is endothelium. This is endothelium or blood vessel. This is endothelium. Endothelium. This is endothelium. We have two molecules, ICAM, VCAM. ICAM and VCAM. ICAM is nothing but ICAM is intercellular cell adhesion molecule. Intercellular cell adhesion molecule. VCAM is vascular cell adhesion molecule. Vascular cell adhesion molecule. Where are these present? See, intercellular cell adhesion molecule. Intercellular means it is present in between the cells, right? This is ICAM. This is ICAM. Then vascular cell adhesion molecule. Vascular cell adhesion molecule, where it is present, even though it is present in all endothelium, when there is a gap, when there is a gap, this vascular endothelium will, vascular cell adhesion molecule will get exposed. We know that neutrophil was rolling and reached here. Neutrophil reached here. Neutrophil reached here, and it gets attached to this vascular cell adhesion molecule, VCAM or ICAM. Okay. But now, guys, see, to attach the WBCs also should have some receptors, right? then only it can go and stick to the we can see. Previously, what was it having? CLA Lewis receptor, another protein on WBCs. It is integrin. It is integrin. What happens? What happens? This integrin will get attached to the ICAM or VCAM. ICAM or VCAM of endothelium. ICAM or VCAM of endothelium. But this time, this is a strong bond. Previously, it was weak bond, right? The blood flow can easily push the neutrophil. But now, what happens? It is a strong bond. Since it is a strong bond, blood flow cannot push the neutrophil forward. What happens if neutrophil cannot go forward? Means neutrophil will get aggregated. Means more and more neutrophils will come in this site. Why only this site? Because here there is a bacteria. Okay, since there is a bacteria endothelium left gap, since the endothelium left gap rolling occurred, previously vascular changes occurred, and we know this plasma is flowing out. Plasma is flowing out, and along with the plasma it should take WBCs. For WBCs to enter outside, this rolling was occurring, and rolling, after rolling, adhesion, it adhered at this junction. Okay, after adhesion, the next process is diapedesis. Diapedesis, what is this diapedesis? See, if this is endothelium and here there is gap, this is endothelium, and here there is gap. Neutrophil reached here. Neutrophil reached here. What is this? What is this protein? Yes, it is ICAM or VCAM. Now there is another molecule called PECAM. PECAM. What is this PE? PE is platelet endothelial. Endothelial cell adhesion molecule. Okay. Now what happens, guys? Blood flow is not sufficient. Means blood flow has no effect to push the neutrophil forward. But this PCAM can attract and it can break the bond. Even though it is a strong bond, PCAM can break this bond. So what happens if this is endothelium and here there is PCAM? There is PCAM. Previously neutrophil was here. Previously neutrophil was here. Then it will come here. Neutrophil came here. PCAM broke the bond. Strong bond. Okay. PCAM broke the bond and it reached here. Even though, see, Neutrophil is crossing endothelium. Neutrophil is crossing endothelium, but we know the layers of blood vessel, guys, right? First is endothelium, and then there is basement membrane. Basement membrane. There is basement membrane. Even though it crossed neutrophil crossed endothelium, there is basement membrane intact. Then how? But bacteria is outside the basement membrane, means outside the blood vessel. Then what should neutrophil do? It should do something, right? What it can do? Guys, neutrophil, it's a granulocyte, right? If this is a neutrophil, if this is neutrophil, it has granules, right? What happens now? Neutrophil releases granules. Neutrophil releases granules. These granules contain collagenase. Why collagenase? Because basement membrane is made up of collagenase. This is basement membrane. It is made up of collagen. Made up of collagen. To digest this collagen, neutrophil releases collagenase. Neutrophil releases collagenase. Neutrophil releases collagenase. Then what collagenase will do? It will it will digest basement membrane, and it will form gap, right? Will form gap. See how beautiful, right? Neutrophil made its own way. The same way our enthusiasm should also be there, guys. To learn anything or to get any success in life, we should make our own way. See, neutrophil is teaching us how to become success. Neutrophil gave way, basement membrane gave way. Then now, see, now neutrophil can easily come out, right? Come out of blood vessel. Okay. What is this, bro? What is this, guys? This step is degranulation. Degranulation. When degranulation occurs, basement membrane will be digested by collagenase, and neutrophil came out of the blood vessel. Now what happens? Next process is fourth. Next process is chemotaxis. Chemotaxis. Chemo. What do you mean by chemo? Some chemical, right? Some chemical. Guys, here we have two ways. One is endogenous, exogenous. Exogenous. Endogenous, what happens? Uh, Guys, you know, right? Neutrophil is a mesenchymally derived. Mesenchymally derived means it should have, yes, actin and myosin. Neutrophil, it's a mesenchymal. It's a mesenchymal derived, and it will have actin and myosin. It will have actin and myosin. What happens if this is a neutrophil? If this is a neutrophil, if this is a neutrophil, actin are present here inside actin. This will form aggregation of actin. This is aggregation aggregation of actin aggregation of actin. When more and more aggregation of actin will occur, it will form, there will be a protracted state. We'll call this as pseudopod. We'll call this pseudopod. Why is this important? See, if there is bacteria here and neutrophil came out of blood vessel, neutrophil is here, neutrophil is here. Wait, bacteria, it is not this much far. Okay, bacteria is here, but neutrophil should recognize bacteria where it is. It should search for bacteria, right? If bacteria is here, then neutrophil will protract its pseudopod towards bacteria. And when this pseudopod reaches bacteria, this will retract neutrophil. See, previously neutrophil was here, bacteria was here. It is protracted and reached bacteria. Then as soon as pseudopod reaches bacteria, it will retract neutrophil and neutrophil comes here. Neutrophil bacteria. This is endogenous because endogenous inside the cell, right? Actin and myosin, which is inside the neutrophil. And exogenous, what is the exogenous mechanism? See, this is a blood vessel. Neutrophil came here, bacteria is here. What happens now? Bacteria will generate eat me signals. Eat me signals. Eat me signals are generated. From these eat me signals, neutrophil can easily reach bacteria. See, since these signals are emerging outside the cell, outside the neutrophil, right? Hence it is exogenous. After chemotaxis, phagocytosis. Finally, in chemotaxis, what happened? Neutrophil reached bacteria. Then now, phagocytosis. Phagocytosis will occur. See, bacteria was there. Neutrophil came. Neutrophil came. Neutrophil came. It reached bacteria. It should phagocytose. For phagocytosis, what happens? When this neutrophil engulfs this bacteria, it will look as this. Bacteria will be inside. But you know this, guys, neutrophil also has lysosomes. What is this lysosome? Suicidal bags of cell. Lysosomes. Lysosome, this is bacteria. Lysosome and bacteria. Okay. We'll call this condition, wait, bacteria. We'll call this condition, we'll call this structure as phagosome. phagosome. This is phagosome. when there is lysosome when there is lysosome and also bacteria in a neutrophil, we'll call this phagosome. After this, what happens? This lysosome and bacteria will fusion of lysosome and bacteria. Fusion of lysosome and bacteria. We'll call this structure as phagolysosome complex. Phagolysosome complex. Guys, as soon as phagolysosome complex formed, it will activate NADPH oxidase. NADPH oxidase. What NADPH oxidase will do in present, it will convert oxygen to superoxide. It will convert oxygen to superoxide. Superoxide. If you remember, guys, superoxide, it's a free radical, right? It's a free radical. It's a free radical, and in presence of superoxide dismutase, enzyme, hydrogen peroxide will form. If you know, this hydrogen peroxide also is a free radical. Why is this important? Why are we studying this hydrogen peroxide and all? And why this uh, neutrophil is, uh, when it is phagocytosed bacteria, it is activating NADPH oxidase. See what happens now. We got hydrogen peroxide. Now the next step is halogenation. I will write here. Halogenation. Halogenation will occur. One side chloride will chloride halogenation. One side is iodide. H2O2 on halogenation will form HOI minus. It is hydroxyl iodide. And now HOCl minus. It is hypochlorite. These both are free radical. What happens? This hydroxyiodide will destroy parasite. Hydroxyiodide will destroy parasite, and hypochlorite will destroy bacteria, right? There was bacteria here, and it should and phagolysis complex form, activation of NADPH oxidase, superoxide formed, hydrogen peroxide on halogenation, it formed hydroxyiodide free radical and hypochlorite free radical. Hypochlorite free radical destroys bacteria and hydroxyiodide will destroy parasite. So, in the neutrophil, bacteria or any parasite is destroyed. And what happens next is, see, neutrophil came outside, right? Neutrophil came out. But remember this, guys, once the neutrophil comes outside the blood vessel, it cannot go inside the blood vessel again. It cannot go. So what happens? This neutrophil engulfed the bacteria or any parasite, any pathogen. It cleared the pathogens. But if this neutrophil is not cleared, then more and more neutrophils will occur, right? More and more neutrophil will be seen outside the blood vessel, right? So what happens now? Macrophage will come. Macrophage. This macrophage will engulf the neutrophil, which engulfed bacteria. Phagocytous neutrophil. Macrophage, phagocytous neutrophil. See how beautiful it is. So the classical finding in acute inflammation is neutrophilia. Neutrophilia. See, once macrophage cleared neutrophil, everything became normal. Uh, this is the end of acute inflammation, guys. Hope you enjoyed well, learned well. Thank you.